Are you pregnant and wondering to yourself what you can expect in the first 24 hours after you give birth to your baby? Well, look no further, let's talk about it here. Hi, I'm Alex. I'm a doula, a mama of two, and a childbirth educator, and I'm passionate about helping families birth their babies fearlessly. So let's get into it. You just pushed out your baby, the throngs of labor are done, and now that beautiful baby is sitting or laying on your chest. This is postpartum. So the first thing I really want to point out is that this version of this video is specifically hospital based. So if you are planning on having a hospital birth, this is kind of what you can expect. A little disclaimer is I'm not a healthcare professional. I am simply a doula and a childbirth educator. Everything I say in this video is just to help educate, not to diagnose, cure, or do any of that. Please walk through your whole pregnancy with a care provider. So as I was saying, this specific video is for those mamas out there who are planning on having hospital births. So you just gave birth in the hospital, your OBGYN is still in the room, or maybe your midwife is still in the room as well. The first thing that they're going to do immediately after baby is born is wait for your placenta to be delivered. So if everything is going smoothly and you have chosen to have a reactive approach to birthing your placenta, simply it's the waiting game. They're just gonna wait for the contractions to kick in a little bit and birth that placenta. If you are more proactive in your approach to the placenta, you will have already received a shot of Pitocin or synthetic oxytocin to get your uterus contracting, cut off the blood vessels to that placenta, and birth it. Your OBGYN or midwife might help in applying a little bit of tug pressure to the placenta, but again, it's all depending on your OB or your midwife or your care provider. Then once that is done and your placenta is out, your OBGYN or midwife is going to check under there and see if you had any tearing or any lacerations. So this is when you're going to get some freezing if you didn't get an epidural, and they're going to do some cleanup. They're gonna stitch you up, and you are just gonna love on that little baby of yours. Then they're gonna give you just an hour of skin to skin, so long as baby is doing fine. You'll be able to just lay there as things are happening. Either your doula or a nurse is gonna bring in probably a piece of toast with either peanut butter or jam and maybe something to drink. Labor is a marathon, so it's good to get your energy back by just giving you something as simple as toast. Let me tell you, when I say that toast is quite possibly the best toast of your life, I mean it is quite possibly the best toast of your life. Then, after your golden hour, or that 1 hour of uninterrupted time with baby is going to be taken and their newborn exam is going to be done. Now, I'm not going to get into that in this video because I'm trying to cover the first 24 hours. So the newborn exam is happening, and if you haven't gotten an epidural or any sort of painkillers that would stop you from being able to get up, you're going to be encouraged to go potentially shower and try and pee. So once you've done that, you and your partner are probably going to be rolled into postpartum. So sometimes they'll have a wheelchair. If you feel good enough, you can walk, especially if you did it unmedicated, and they will move you into postpartum. Then once you are in postpartum, you will get your baby back, obviously, after that newborn exam. I do want to note, sometimes it can take 1 to 5 hours of being in labor and delivery, where you're eating, you're trying to nurse baby for the first time, they're doing all the newborn exams, they are entering you into the system or passing you to postpartum, and sometimes they're just waiting for a bed to open up in postpartum. So you can spend anywhere from 1 to 5 hours in L&D or labor and delivery after you give birth to your baby. Then once you are moved to postpartum, if you have a doula or a midwife, they're going to stay with you for about 1 to 5 hours. So if you are in labor and delivery for about 5 hours, your midwife may or may not leave by that point in time. It really depends on the midwife, and then the same with your doula. So it depends on whatever contract you have with them. In that 1 to 5 hours in labor and delivery, you will probably have tried to get baby to latch 1 to 3 times again, depending on how long you've been in labor and delivery. Once you get into postpartum, the biggest thing that you are going to be worrying about if you're deciding to breastfeed is getting that baby latched. You're going to be doing a lot of nursing, a lot of skin to skin. You're probably going to be half naked with a little boobie hanging out. That's just the reality of postpartum. And you're going to probably see, depending on the type of room you got and where you are in the world, a single bed and a chair that folds out for dad. You may be in a private room where it's just you and your own bathroom, or you may be in a room with up to 6 other moms and babies. So this is especially in hospitals. Then you're going to get much needed rest. Now, depending on what time you give birth to your baby will depend obviously on when you receive meals at the hospital. So hospitals usually give breakfast, lunch, and supper every single day. And postpartum also does usually have some snacks. So if you are peckish, especially in those first few hours post-birth, you can ask the nurse who is coming in to check on you to bring you some snacks. They usually have extras on the postpartum floor or ward. But it's good to note that most hospitals will not feed your partner. So if you've got your husband there or the baby's dad, they're going to need to eat, and the hospital usually doesn't provide that. So whether that's them leaving or someone bringing them food, it's just something good to note and maybe prepare them for. You're going to, in those first 24 hours, get a fundal massage and vital checks around every 2 hours. So vital checks for both you and baby, and a fundal massage, which if you don't know what it is, feel free to go look it up. But it's pretty much they come in and they massage that uterus to try and help it contract down to the proper size. This can be a really uncomfortable massage that is done. I have had a couple of people who've asked to not get it done. Sometimes they give in. It's all based on you. Look at what policies and procedures are in your area, and why they're done, and then make an educated and informed decision then. So that's really good to note that every 2-ish hours, there will be an interruption. Even if it's at 2 in the morning, a nurse will be coming in to check yours and baby's vitals, as well as give you that fundal massage and check on your bleeding. You will also be nursing baby around every 1.5 to 2.5 hours. That first 24 hours, baby is usually pretty lethargic. They're pretty tired. They are just wanting to snuggle, nurse, and sleep. You just did the hard work of labor, and so did that baby. So enjoy those first 24 hours. They go by very slowly and very quickly, all at the same time. So between nursing your baby every 2 hours, vital checks every 2 hours, and a fundal massage every 2 hours, it doesn't look like there's a lot of rest that happens at the hospital. If you are in a room of 6 moms, there's also going to be 5 other babies in that room with you that could wake up and cry, probably will wake up and cry overnight. So if you can book a private room, I definitely suggest it, because otherwise you're just not going to sleep. That's just the reality of the first 24 hours in the hospital. There's a lot of interruptions, and I don't think we're prepared enough for that. So then you are nearing the end of your first 24 hours. Usually they will come in and do an anabolic screening. They'll do a little prick on baby's foot and get some blood onto a thing. It's a whole thing. There's lots of testing done for baby. You'll also usually have a hearing test done on baby and a couple of other things. And in order to be discharged, mom and baby have to be checked by specialists. So typically mom will be checked by an OB. whether that's hers or whoever is on the ward at that time. And there will be a pediatrician that comes and does there will also be a pediatrician that comes and does a round at the ward as well. So then once you have gotten those checks and you and baby are good, baby's jaundice levels are low, and you are both healthy and ready to go home, 24 hours is around the time when you can be just discharged and head home. The other thing I totally wanted to make note of is that in that first 24 hours, you are going to have usually a pee and a poo. They want to make sure that baby is peeing and pooing before you leave the hospital. In that first 24 hours as well, if baby does have a poo, it is going to be a dark tar-like substance that is pretty hard to get off of their booty. So sometimes nurses will suggest something like Vaseline. Whatever your opinion is on that kind of stuff, that's just something they'll sometimes suggest. So that's, in a very, very short, quick version, the first 24 hours at the hospital after you give birth to your baby. In those first 24 hours, you do not need to let anyone visit you, or you could have as many visitors as you want. That is completely up to you. That is a decision you get to make. And mama, let me tell you, the lack of sleep that's going to come from those first 24 hours at the hospital, you really get to decide whether or not you want other people coming and bugging you. But I know I would have had people, because sometimes it's just so exciting to share that beautiful bundle that you just pushed out of your body and worked so hard for. So there's kind of what you can expect in a normal-ish birth post 24 hours. One thing I want you to know is that not every 24 hours looks identical to this. This is just the base. So if you went with a midwife, you're probably not going to get the fundal massage as often, because you're still going to be under midwifery care. Depending on where you are in the world, if you're in Canada, different parts of Canada, if you're in the States, wherever you are, these are all going to be different policies and procedures as well. And of course, if there's anything that is wrong with baby or with mom, there might be separation in that first 24 hours. There might be NICU time. It looks different for everyone. But if you have a decently normal, low risk birth, this is kind of what you can expect. I hope that you liked this video. If you did, please give it a thumbs up. Make sure to follow along for more pregnancy and birth tips, and I'll catch you on the next one. See ya!